Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing the medication known as Acetazolamide. Its brand name is Diamox. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications, or reasons we would not be able to prescribe acetazolamide. We'll then discuss examples of dosing, and finish it off with side effects. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here will be the mechanism of action, or how this medication works. So acetazolamide is a non-bacteriostatic sulfonamide. It inhibits carbonic anhydrase from catalyzing the reverse hydration of carbon dioxide and dehydration of carbonic acid. In terms of indications or reasons we would prescribe this medication to a patient, well, we may see this medication prescribed in the treatment of glaucoma, as well as epilepsy or edema, and finally here it can be prescribed for the treatment of acute motion sickness. With respect to contraindications or reasons we would not be able to prescribe acetazolamide, well, first of all, we wouldn't give this medication to a patient who had a hypersensitivity to acetazolamide or any other component of the formulation. If a patient had hypokalemia or low potassium levels, as well as hyponatremia or low sodium levels, they would also not use acetazolamide. If a patient had renal dysfunction or marked disease, they would not use this medication, as well as if a patient had cirrhosis or chronic non-congestive angled closure glaucoma. Now for some examples of dosing with acetazolamide. In the treatment of glaucoma, when it's used as an adjunct or add-on therapy, we would typically see, if using the tablets, 250 to 1,000 milligrams orally every 24 hours in divided doses. If a patient was using the capsules, the XR version, they may use 500 milligrams orally twice daily. If a patient was treating edema, they may use 250 to 375 milligrams orally once daily in the morning for 1 to 2 days, alternating with a day of rest. As with all medications, there are some side effects or adverse reactions that patients may experience while using acetazolamide. We'll go over some of those here now. Some patients may experience a headache or dizziness. Some may experience tiredness or a frequent urge to urinate. A tingling sensation in the extremities is possible, as well as a loss of appetite, excitement, or a feeling of sickness. Diarrhea or a taste change is a possibility, as well as flushing or numbness of the extremities. More serious side effects would be hepatic necrosis, nephrotoxicity, or a sulfonamide adverse reaction. Alright everybody, that's all we're going to talk about today with acetazolamide or Diamox. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.